Neuropsychological rehabilitation is a therapeutic service for people who have had various types of brain injuries. So it could be ranging from a paralytic stroke to a road traffic accident which causes a brain injury, or even age-related illnesses like Alzheimer's. What happens because of a brain injury is several different areas of brain function get affected. These could be cognitive, emotional, behavioral, as well as physical functioning, speech function, and that's why a whole team of people come together to work on the rehabilitation of the person. Along with just the person, because brain injuries are family illnesses, what that means is they affect not just the patient but also their family. So, what happens is, as a neuropsychologist, we have to work with the family as well to improve their quality of life and the patient's psychosocial functioning. So, the first stage is when the patient is in the hospital being stabilized by a surgeon or a neurologist, and after that, they receive intensive inpatient care in the hospital, which is the acute stage. Thereafter, the patient comes in to an outpatient clinic like ours, and they receive holistic care, which is provided by a multidisciplinary team. It could consist of a neurologist, a psychiatrist, a neuropsychologist, a physiotherapist, and so on and so forth, depending on the patient's difficulties and symptoms. In neuropsychological rehabilitation, we work with cognition, emotion, and behavior, apart from the psychosocial family functioning. So, cognition is very simply understood as the thinking skills that a person has: memory, the ability to pay attention, the ability to problem solve by comprehending information around them. Emotions are your mood as well as your ability to motivate yourself. And then behaviors are usually associated with emotional regulation. So, are you having anger outbursts? Is there increased irritability? These are the symptoms that we address in neuropsychological rehabilitation. So, neuropsychological rehabilitation can help people who suffered paralytic strokes, chronic illnesses like epilepsy, or age related illnesses like dementia, or even road traffic accidents which cause brain injuries. Very often, what happens is it affects independent living, or the ability to go back to a job or sustain a career becomes practically impossible. This can happen because of several impacts on their cognitive functioning. The difficulty to recall information or store new information, any kind of learning can become difficult. The ability to even pay attention to a conversation or being able to be part of a group meeting, the ability to make decisions in the correct manner or quickly solve problems, all of these can get affected. What can also happen is that an individual's relationships with their family and friends can get affected, which would be because of impulsivity, it could be because of anger outbursts. There are several emotional and behavioral symptoms that also occur because the brain is injured. In this situation, neuropsychological rehabilitation and the kind of activities which are done in the process and the compensatory strategies that are taught to the individual as well as the family can definitely help a person. As everything related to brain health, in India we have some advantages and some disadvantages. Currently, there is some amount of awareness related to neuropsychology and the kind of rehabilitation which is actually required, but there is limited supply of these services. So, what would be very important for people is to actually recognize and educate themselves so that then they can ask their doctors and look for these services. After a brain injury, it's important to address every aspect of an individual, not just the physical. So we need to focus on the person's individuality as well as their personality, their ability to get back to work and sustain an independent life. For that, neuropsychological rehabilitation, along with physiotherapy, speech therapy, and occupational therapy, can provide the kind of multidisciplinary care that a person would require.